want to bring in our next guest, and we're going to talk about artificial intelligence touching everything from curing disease to providing recommendations on business decisions. Niven Narain is co-founder, president, and chief technology officer at Berg, based in Boston. Right now, though, he's at the J.P. Morgan Health Conference in San Francisco, where so many individuals are. It's a really closely watched event. Niven, nice to have you here with Corey and myself on this Thursday. Talk to us about what you guys are specifically doing when it comes to artificial intelligence.
Thank you, Carol. So Berg is taking a really novel approach to using artificial intelligence in the healthcare space. Our real approach is to combine the robustness of the biological data in patients, their healthcare data, and then use the artificial intelligence to help us understand that data where, as you can appreciate, this data is enormous. So, one cannot humanly process that amount of data. So by allowing us to understand that data in a more efficient manner, we're able to understand the areas in the biology that's gone wrong between a healthy individual and then an individual who unfortunately may have a disease like cancer or Parkinson's or diabetes, so that we can develop drugs that are more geared toward the biology of that patient instead of just the traditional mold of developing a chemical screen that unfortunately has led to more side effects and toxicity, et cetera. So just more efficient drugs that are more tailored for the patient.
Interesting. What kind of data are we talking about?
So data that would include gene sequencing data on a patient, their metabolism data, their real world data, their healthcare data, et cetera, so that we can combine all that data on that patient and really create a full narrative of what's ongoing in that individual instead of just saying, well, this patient has cancer, he or she has a diagnosis. We're able to go much deeper and say, here are the genes or proteins or the metabolites that have gone wrong in that system, so that we can, one, understand that patient more efficiently, but two, we're able to develop drugs and diagnostics and biomarkers to help decide which drug is going to work for which patient. And, this is really the vision of precision medicine. The Obama administration had released the initiative last year, and I think these technologies allow for the true vision of precision medicine to take hold.
Niven, I think ever since IBM's supercomputer Watson made kind of history 4 years ago when it beat two contestants on Jeopardy,
Right.
We've all been excited about what artificial intelligence can do, but for most of us, it's still kind of the stuff of sci-fi movies. And this is actually the subject of a story in Bloomberg Business Week this week about it questions better living through robots. And by robots, it means technology at large, artificial intelligence. I get it. I want to buy into it. I think it makes sense. It's going to be able to organize all the information that's out there. But is it truly going to make a difference? When does it start to truly make a difference? Because if you look at all the technology that's out there, yes, there's a fair amount of automation. But if you look at economic statistics, we don't necessarily see the betterment through technology being played out in a lot of statistics in terms of things like labor productivity and so on and so forth. So is this going to really make a difference? When do we start to see it make a difference? How do you measure it?
So I think, at least in the healthcare space, we can start to measure it in a very concrete way by assessing which drugs are going to work more efficiently on those patients. And, of course, we're going to have the outcome data on those patients. So very quickly, we're going to be able to appreciate, here's a model that predicted that if this patient took drug A or as compared to drug B, he or she would fare better. So the population data in that example would surely take hold. And I think that we don't actually realize that we're using a lot of products and we're using a lot of consumer-driven touch points every day that is already using AI. For example, if you get a new computer and you load up your email on that computer and you sign into Gmail, but you went on ESPN the night before, you went on CNN and the New York Times. A week later, those ads from those sites are going to be populated on that page for you. So the AI is learning your consumer habits, it's learning what your interests are, and it's making that more efficient, at least on a search engine. That's a very simple example, but it's something we do every day.
It's interesting because I wonder sort of about the data sources. If the data sources can start to be really different. What I expected you to talk about was sort of the unstructured data that we get about knowing so much more about the people who would be consuming the drugs, not just the drugs themselves. That can suddenly let us know a lot more about what's going to work in a very specialized audience.
I absolutely agree with that, and I think that's one of the just to paint a scenario where you may have a lady in New York with a breast cancer diagnosis and have the same type of diagnoses with a lady in San Francisco. They both use the same drug, but they have a different outcome. So the lady in New York has a response. At Memorial, the lady treated at Stanford, unfortunately, does not have a response. These systems, the use of these types of technologies, then allow us to take the samples from those patients, their blood samples, and say, what is it in this patient biology that unfortunately is not a good match for the first line of therapy? So then the physician and her clinical team can then say, well, based on this biological outcome of this patient, she may respond to drug B or drug C. So making that clinical decision and arming the physicians and that clinical staff with more of a data-driven arbitration point than just going by line of therapy. And I think that the next few years, not only in cancer therapy but in many other disease states, these technologies are going to help drug developers to become more efficient, but also even at the physician level to have better tools to make more informed decisions.
Interesting. But it's still a few years before we really start to see the payoff. Just got about 20 seconds here.
Yeah, I think it may not even be that far. I think you're seeing companies like Berg and others, really take hold. This is the development of AI is beating Moore's law for utility and integration in healthcare. So I think it may be as early as a year to a year and a half that we start to see concrete things. And at Berg, we're seeing that already internally today.
All right. Well, nice to check in with you. Niven Narain, co-founder, president, chief technology officer at Berg, based in Boston. But on this Thursday, we find him at the J.P. Morgan Health Conference in San Francisco, something that we'll be tracking and bringing some news from. All right. You are listening to the Bloomberg Advantage. Carol Masser in New York, Corey Johnson in San Francisco. We are Bloomberg Radio.